Christy.
Hello.
I'm Abby. I'll be your physical therapist today.
Nice to meet you.
Nice to meet you. First, can I just have you verify your date of birth for me, please?
It's January 14th, 1994.
Okay, great. And so I've been reviewing your forms, and it says that you're here because of some right shoulder pain. That's a result of lifting too much at the gym and then pain in your house.
Yep.
Can you tell me a little bit more about how it started hurting at the gym?
Yeah, so I was in the gym doing my regular routine and going for a new personal record in an overhead press. And as I was doing it, I felt a sharp pain. And yep.
Okay. So you felt the pain like while you were doing the exercise?
Yeah.
Okay.
Yeah.
And then did it hurt afterwards?
When I used it for like chores around the house, things like that.
Okay. But then it got pretty bad after you painted your house?
Yeah, that was when I knew there was a real problem.
Okay. And you said that the pain is worse during the day and at night, correct?
Yeah.
This pain at night, does it affect your sleep that much?
No, only when I'm trying to go to sleep, when I'm laying on it.
Okay.
Other than that, no.
So it like never wakes you up in the middle of the night?
No.
That's good. So how would you describe this pain? Is it like sharp or achy or dull?
It's sharp and achy around the area.
Okay.
Yeah.
Does it ever feel like it's kind of going dead?
Yeah.
Yeah.
Yeah. Definitely get that feeling.
Okay. And so you said it's over here, like is it front, back, and side?
Yeah.
All around?
Yep.
Okay. Does it like radiate down your arm ever?
No.
No. Okay. Just mainly in the shoulder area?
Yeah.
Okay. And you said this pain is worse during activity.
Mm-hmm.
Does it hurt like when you're kind of done doing the activity, or only like when you're using it?
Only when I'm using it,
Mhm.
usually, yeah.
Okay. Does it hurt you like at your job as a teacher?
Yeah. Because on the whiteboard and things like that.
Yeah, I'm sure you have to use your arms a lot.
Mhm.
Okay, which movements like hurt the most?
Like if I'm in the shower washing my hair, or ever have to raise things above my shoulder, you know?
Above your head?
Yeah, above my head, yeah.
Okay. I also see that you use heat and some ice and Tylenol to help with the pain. Is that pretty effective?
Yeah, that helps, yeah.
So how much Tylenol are you taking a day?
About 2,000
Okay.
milligrams.
Yeah. And just to double check, you also take a multivitamin, fish oil, and CoQ10?
Yeah, just the recommended amount.
Just like one a day,
Yeah.
supplement? All right. I also see in past medical history that you had an arthroscopy on the left shoulder about 4 years ago after a hockey injury. Did they find anything when they did that?
Yeah, they found something, but I can't remember the name of it. But yeah, that they figured it out.
Was it like a subluxation?
Yeah, that was it. Yeah.
Yeah, that's a common hockey injury.
Yeah.
All right. Does that still bother you ever?
No.
That's good. All right. Almost done with these questions. I'm just gonna ask a few more just to rule out other things. So, have you ever experienced any like abnormal sensations, like pins and needles?
No.
Have you experienced any like new headaches?
No.
Since injury? No. Any like, I know you kind of said it, but really bad night pain?
No.
Any like when you wake up in the morning you feel really stiff and then it doesn't lessen throughout the day?
No.
What about any lightheadedness?
No.
And you haven't experienced any trauma like a fall or a car accident or anything?
No.
And then have you had any like recent new night sweats?
No.
Any constipation?
Nope.
What about like easy bruising?
No.
And then last, just any recent changes in vision?
No.
Okay, cool. So I'm done with all the questions. Now I'm just gonna have watch you move a little bit, and I'm gonna do some special tests on you just to try to figure out what's going on with your shoulder. That's gonna involve me like touching your shoulder area, maybe your arms and hands. Is that okay with you?
Yep, that's okay.
I'll let you know what I'm doing before I do it, of course. So first I'm just gonna have you raise your hands above your head. Any pain there?
Yeah. On my right
Just
side,
like at the top
Yeah.
only? Okay. And now raise your hands behind your head. Any pain there?
A little bit,
A little bit? Okay.
Yeah.
And then put them behind like this. That feels fine?
Yeah, that's fine.
Good. And then reach over like this. Good.
That's fine.
Other way. Good.
That's fine.
And then last one, just go straight back. Good.
That's fine.
Awesome. All right, now I'm just gonna have you with your right arm, you're just gonna come up like this, all the way to your head. How's that feel?
That's a little sore near the top.
Near the top?
Yeah.
None like in this area? Okay. All right, so this next one, I'm just gonna look at your scapula, which is the bone back here. I'm just gonna watch it move as you elevate. If you could take off your shirt for me, please. Thank you. So you can face this way. And what I'm gonna have you do is just raise these up. Good. Pain up there again?
Yep.
Yeah? Okay. You can come back down. All right, and now you're gonna reach straight out in front of you. Pain right there? Okay. You can come back down. Thank you very much. All right, I'm just gonna do a test on you. So I'm gonna have you take this. You're gonna move it a little bit here. You're gonna put your thumb down. I'm gonna push down on it. I want you to tell me if there's any pain, okay?
Yep.
Yeah, pain?
Yeah.
Okay. So now you can go like this. Up. I'm gonna push down. Let me know if there is any pain.
No.
Great. Okay. So next one, I'm gonna have you sit down on the table, please.
Lay down or sit down?
Sit down, please.
Okay.
So I'm just gonna roll this up so that I can look at your shoulder a bit better. Alright. Just gonna kind of look where your arm bone fits in your shoulder bone, just to see if they're aligned. Okay. Good. Just gonna do that on the other side. Okay. Now I'm just gonna look at some of your things that are happening at your shoulder joint right here. Just gonna have you here. Just gonna pull down on your arm for a second. Good. Okay. Another test, still gonna look at your joint. So I'm gonna have you here. If you could take this hand and put it behind your back just to stabilize. I'm gonna push in and then I'm gonna come around this way. Good. Any pain there?
No.
Alright, now I'm just gonna test the muscle strength of one of your muscles that lets you do this. So I'm just gonna do your left side first. I'm gonna have you come here. I'm gonna push down. I want you to resist my force. Keep it up there, okay? Good. Any pain?
Nope.
Now I'm gonna do this one, same here. Okay. Thank you. Is that painful?
A little bit.
Okay. Alright, just one more while you're sitting. Just gonna do this. I'm gonna push in. I want you to tell me if it hurts, okay?
No.
Okay, good. Alright, now I'm gonna have you lay on your back, please, on the table. So what I'm gonna do is I'm gonna have you keep this there, and you're gonna keep this here, and you're gonna go as far as you can this way, and then as far as you can that way, okay? But I'm gonna measure them, so first just go palm to the table. Okay, keep it there. Alright, I'm gonna push a little, is that okay?
Mm-hmm.
Okay, good. And now you're gonna go backwards. Okay, I'm gonna push a little. Very good. And then bring that down. Awesome. And then I'll come do this side. Alright, so I'm gonna go same, so you're gonna do palm down. Alright, I'm gonna push a little, is that okay?
Mm-hmm.
Alright, now I know, I'm gonna go the other side, I know it'll probably might hurt a bit, but just go as far as you can, okay?
Okay.
You can go. As far as you can go?
Yep.
Alright, I'm just gonna push a little, I don't do too much.
Ah.
Sorry.
Yeah.
Okay. And then I'm gonna do one more. So I'm just gonna have you reach up as far as you can over your head. As far as you can. There we go. Very good. I'm gonna come to your other side. I know this side might be a little painful too, so just go as far as you can. All right. I'm gonna push a little bit. I won't push much. Okay. Painful?
Yep, a little bit.
Go down. All right. Just a few more, I promise. I'm gonna do a test over here. So what I'm gonna do is I'm gonna press down into that position that I was just measuring.
Mm-hmm.
Okay, I want you to let me know when it hurts.
Ow. Yeah.
Okay. Tell me if this makes it better.
Oh yeah.
Yeah?
Yeah.
Okay, good. Alright, one more on your back. I'm gonna have you here, and then I'm gonna have you try to put your palm up like that, and then you're gonna right here. And then I'm gonna try to pull this out. Keep your elbow flexed, okay?
Okay.
Painful.
Yeah.
All right, just one more thing, but I'm gonna have you on your tummy, please.
Okay.
Okay, so I will do this side first. Let me grab my towel. You're doing great.
Thank you.
So I'm gonna have you start like this, and I'm gonna push. Nope, you can keep it down.
Alright.
But then keep it right there. I'm gonna push. Don't let me break you, okay?
Okay.
Very good. Now you. Then we'll do this side. Don't let me break you.
Mm-hmm.
Very good. All right, I'll come do the other side. Okay, don't let me break you. Okay, good. All right, I know this one's gonna be a bit painful, but just do as much as you can.
Ow.
All right. So, you can sit up now for me, please. Okay. So you did great.
Thank
First
you.
off. Judging from the test and some of the values that I got for your like range of motion and strength, I think you might have what's called a SLAP tear. SLAP stands for superior labrum, anterior and posterior. So in your shoulder, since it's a very mobile joint, it needs a lot of things in there to keep the bones together. And the big thing is a labrum, and it kind of acts like a suction. And the SLAP is like the top part of your labrum. And you can tear it sometimes by like lifting something really heavy. And then it also is aggravated by a lot of overhead movements, which I'm sure probably aggravated it with painting your house.
Yep.
And so I would recommend going to the doctor for an arthroscopy, because that is the like for sure way to diagnose it. But what I can say for you now is I would just really recommend trying to avoid aggravating movements. I know it's hard because you're a teacher and you really like working out, but just right now to try to decrease stress on the irritable structures, I would really recommend not doing like, try not to minimize overhead movements, and anything this is called external rotation, anything you have to do this. So I know like washing your hair, maybe try primarily with your left. Maybe even use a sling. That kind of helps you just like know like, oh, not to use that arm for those kind of things. I also want to practice good posture, because this can also make stress on those tissues. So for the rest of today, I just want to do some gentle range of motion exercises with you, because you are already showing a bit like stiffness in certain directions, and so I want to do that to prevent any further stiffness. We can also work on stretching these muscles right here and in your spine, because that can lead to the forward shoulders, which can aggravate this condition. And then as your visits progress, we'll work on more strengthening exercises of like the shoulder and all the surrounding muscles, and that can lead to like overhead exercises, so we can get back to all the stuff you can do as a teacher and weightlifting, because I know that's really important to you. But of course, you need to let me know what's working for you. This is like your treatment plan, and so we'll work together and hopefully have you back in the classroom with no pain and lifting weights in no time. Do you have any questions for me?
No.
No?
Thank you for taking care of me.
You're welcome. Does this all sound good to you?
That sounds good.
Great. It was nice working with you.
Nice working with me too.